The distinguished speakers today are Sri Jayant Sahasrabudhe, who is the National Organizing Secretary of Vigyan Bharati, Dr. T.G. Sitaram, Director IT Guwahati, Dr. G. Data Krishnan, Technical Officer of Traditional Complementary and Integrative Medicine of WHO. I also would like to request in the meantime, I also like to request to all the participants to switch off the mute the phone, microphone, and video during the sessions. Here, as this is a program of NIPER Guwahati and Vigyan Bharati, and notice front of Vigyan Bharati, I like to say a few words about NIPER Guwahati. NIPER Guwahati, it is the only national institute which is located here in the northeastern part, which is basically involved in the education, pharma education and research. It was established in 2008 to provide high quality pharma education and research. And as we are all know about Vigyan Bharati, still I love to say a few lines about Vigyan Bharati and Annie Brandt, Northeast Science Movement. Vigyan Bharati, it was started in Indian Institute of Science, Bangalore, by a few eminent scientists and under the guidance of Professor K.I. Vasu. This movement gradually gained momentum and emerged as an organization with national presence. And in 1991, it was decided to launch the Swadeshi Science Movement at all India level, and it is named as Vigyan Bharati. Vigyan Bharati is working with a Swadeshi spirit, interlinking traditional and modern science in one hand and spiritual science on the other hand. Vigyan Bharati has units in 22 states across the country. It is working in 11 different areas through autonomous institutes and independent organizations. Today, we are grateful to have Sri Jayant Sahasrabudhe on this program, and we like to request Sahasrabudhe to deliver the keynote address in this platform. I also like to add a few lines about Northeast Science Movement. Northeast Science Movement is one of the leading science movement from Northeast India, promoted by scientists, engineers, and other science enthusiasts, and is affiliated to Vigyan Bharati. Northeast Science Movement has also started different talk series to popularize science in this region. It is formed in 2016. It's here in Maligaon, and it is a registered society affiliated under Vigyan Bharati. So this is in this situation, we are having this type of platform to discuss different issues. And as this is a program on Colloquy on integrative healthcare, and we have different eminent scientists and eminent figures, eminent personalities throughout the world who is going to talk with us, who is going to deliver their speech over here. And at the end of the program or at the end of every sessions, what you could do, if you have any questions, you can drop your message over here in the chat box, and we can hand over those questions to the panelists. One more request to all of you, please switch off the mic. Switch off means mute option, and also the video during this video. And please drop the messages on the chat box. And note that we have Jayant Sahasrabudhe, who is also the National Organizing Secretary of Vigyan Bharati. I request Jayant Sahasrabudhe to deliver the keynote address for this program today. Now, sir. Hello. Okay. Uh, I also like to state here that participants can drop any type of questions here in the chat box. Jainji is on his line. There are some network programs, so he is going to deliver the speech shortly. So I believe this will be a very good program for all of us, and I like to have active participation of all the presenters and all the attendees in this program.
हाँ नमस्ते। हाँ मैं तो आ गया। नमस्ते।
Hello. Yes, sir.
नमस्कार
Sir.
सीताराम जी नमस्ते।
नमस्कार सर।
नमस्ते
नमस्कार नमस्ते नमस्ते।
Sir, I request you to deliver the speech, sir. JNG, sir.
Shall we start now?
Yes, sir. Yes, sir.
So namaste, and I welcome everyone, those who are participating in this two-day webinar series, which is going to start from this session. I also welcome our expert speakers, Professor Sitaram ji and my friend Vaidya Geeta Krishnan ji, who are our expert speakers over here in this session today. And we are going to learn lot many things from them. So I welcome both of them to this session. I really appreciate this collaborative effort of Northeast Science Movement and NIPER. They have organized a very good webinar on the relevant topic on integrative healthcare. So today, really, this is what we really need. So today, our expert speakers and those who are going to be there in this two-day webinar, they are going to give us or they are going to share their experiences, share their knowledge on this particular topic, which is of great relevance in these days of pandemic. So we are all eager to listen to them. And we know that as soon as we get some knowledge from them, we need to implement that. We need to practice that in our daily life so that we will be able to face this pandemic in a better manner. So with this note, I welcome again all of you. We know that Northeast Science Movement is a chapter of Vijnan Bharati in northeastern region of our country. Vijnan Bharati is a national science movement and popularly known as Swadeshi Science Movement. That is science movement with Swadeshi spirit. There are two dimensions of this component Swadeshi. One is, this is a science movement, national science movement for Swadeshi sciences. We know that, unfortunately, with the advent of British rule, we did forget the scientific heritage we had in India. But we know that our ancestors have contributed a lot in the field of science and technology. And even today, the eminent scientists of modern science, they also acknowledge this contribution of Indians to the development of modern science. So there is a great responsibility on our shoulders to preserve, to conserve and protect scientific and technological knowledge which was developed in India. So Vijnan Bharati as a Swadeshi science movement is working in this direction, that we need to protect our own scientific heritage, and there is a great need to develop that scientific heritage in today's age. So that is one component of this Swadeshi dimension. There is another component. We need to make our country self-reliant in all aspects of life with the intervention of science and technology. We know that in today's world, in this age of science, science and technology plays great role in the development of any country and society. So there is a great need that we should develop our own science and technology which is needed to solve our own problems in this country. So Vigyan Bharati is working in that direction. We say that we are supposed to develop our own scientific and technological tools which will take care of problems of our own society. So this is what we do mean by Swadeshi. Swadeshi, on one hand, it is meant for Swadeshi science, and on other hand, it is meant for a self-reliant India. We know that today we are in this unprecedented times of pandemic because of coronavirus, COVID-19 disease. People, especially in the field of science and technology, they are taking hard efforts to get solution for this disease. They are in the process of preparing drugs, vaccines, and so many other things to protect humans from this great disease. So everyone, not only in our country but throughout the world, science and technological fraternity is engaged in that kind of work. They are taking hard efforts to bring out solutions for this pandemic kind of situation. There are many other aspects of this pandemic also. We are actually facing economic slowdown, not only in our country, but throughout the world. Economic systems are on the verge of collapse because nothing is moving. So we need to come out of that situation also. That is also going to be a great challenge for all of us. But today, at present, we need to face this great problem which is there in front of all of us regarding health of everyone on this. And we know that all kind of efforts on modern scientific tools, we experiencing that there are great limitations for that. So people are thinking of integrating health knowledge in the domain of traditions with the modern scientific knowledge. So that is what is going on in today's world. People are trying to integrate two streams of knowledge. One is traditional, another is modern. We know that there are several efforts going on in our country because we do have that kind of scientific heritage. And we know that people all over the world, they are looking at India to gain knowledge out of that traditional healthcare system. Recently, when we did observe World Yoga Day on 21st of June, we have experienced, even in these days of lockdown, people across the globe, means almost in 200 countries, people have celebrated or have observed this World Yoga Day, International Yoga Day. Why they have observed it? Because all of them know that yoga is nothing but a kind of science, a science which can get you solutions for your today's problems. So people all over the world, they are trying to seek knowledge of yoga from India. People are expecting greatly from our country that Indians will provide great knowledge, scientific knowledge about yoga to the entire humanity. People are waiting for that. And now people have started integrating these ancient Indian scientific knowledges with modern scientific knowledge. And they are coming out with many new concepts which are really useful in conditions like today. So people are they are having great confidence that if we can really integrate these two streams of science, one is traditional and one is modern, then we will be able to get solution for all the health problems which we are facing at this moment. So I think NESM and NIPER, they have chosen a very relevant topic in today's situation, that how we need to take care of our health in an integrative manner. So I wish all the success for this seminar or webinar, and I'm very much confident that expert speakers, those who are going to share their experiences out of their knowledge, they are going to enrich us in this direction, that how we can integrate several streams of knowledge for a great healthcare of entire humanity. Again, I wish a great success for this webinar, and I welcome everyone to this webinar for 2 days. And I'm really grateful to organizers to give me an opportunity to share some of my thoughts over here on this platform. Thank you.
Thank you, sir. Thank you, sir, for your valuable speech. This is the time, this is the high time that we have to move towards the Swadeshi in any branch, whether it is yoga, whether it is medicine, everywhere we have to move towards our origin. Thank you, sir. Thank you very much for your kind speech. We expect your presence throughout the whole session. And as director sir is already available, I'd like to request Ankush to say a few words. Ankush,
Yeah, hello.
hello, Ankush. You can start, please.
Yeah, ma'am. Thank you, Sahasubudhe sir, for your kind words. We are highly blessed that today, as we all know, the science heritage which is lost by which has been gained by our ancestor is lost by our generation. So it is a well-known session we have got to organize for 2 days. And thank you, Bula ma'am, for giving me this opportunity. Hello and good evening to all our respected speakers and my fellow mates. I, Ankush Jha, serving as a moderator on behalf of Naipar Guwahati, NESM, and Vijayan Bharti, welcome you all in our first session on resilience and transformation in healthcare emerging areas in future. Just a little housekeeping before we get started. I request all the participants to mute their mic and off their webcam to avoid any disturbance during the session. Also, if you have any question during the presentation, please type them in chat box. I will bring them up during the question answer session. Now, without any further ado, I would like to welcome our esteemed speaker, Dr. T.G. Sitaraman sir, Director of IIT Guwahati, Professor, Department of Civil Engineering, Indian Institute of Science, Bangalore. His academic credentials include PhD from Waterloo, Canada. He has also received various fellowships such as FASCE, FICE UK, FISCT, FIGS, FISCS, and FIE India. He has also received qualification as diplomatant in geotechnical engineering and professional engineering. He is also serving on various posts such as president at Indian Society for Earthquake Technology, Russian Earthquake International Research, Wollongong, Australia. For coastal area, also the chairman of Coastal Roorkee, Uttarakhand. Is also the chairman of Southwestern Regional Committee, AICTE SWRO, editor at International Journal of Geotechnical Earthquake Engineering. Also as a chief editor in Springer Transaction of Civil Environment Engineering. Sir, we are highly obliged that you spare your precious time from your busy schedule to us. With this, I request sir to please share your thoughts to us. Sir, over to you, sir.
Namaste. Thank you very much. Thank you, Northeast Science Movement members of Vibha, Naipur Guwahati, and others from the Northeast. First of all, let me thank Sri Jayant Sahasrabudhi, National Organizing Secretary of Vignan Bharati, and other co-speakers in this webinar, Dr. G. Geeta Krishnan from TCI, Dr. USN Murthy, Director Naipur Guwahati, Dr. NC Talukdar, former Director IASST Guwahati. And I also would like to thank Mr. Rajiv Sharma, Northeast Prant Vignan Bharati Member, Secretary, and Dr. Bula Chaudhary and Ankush Jha and others who are here to listen to my talk. I am going to talk to you more about the integrative healthcare and how IIT Guwahati is coping up in this difficult time of the pandemic. So I also going to highlight to you how to make self-reliant India, particularly in the healthcare sector, and how IIT Guwahati is contributing in this Atmanirbhar attempt of making healthcare accessible to all. And I will try to focus mostly for the northeast part of India. So now I would like to share the presentation. I have a PowerPoint presentation, and I hope all of you can see this. Can you see my presentation?
Yes.
Can you?
Yes, sir. Yes, sir. We can see your presentation.
Yes, sir.
If you can see, then I will make it as a full screen. Okay, I will make that as a full screen. You're able to see?
Yes, sir. We can see, sir.
Yes, sir.
Can you see? I don't know whether you're able to see. Are you controlling, or I should control this?
Sir,
Hello?
We are able to see, sir. You can control, sir.
Yeah, all right. I think, so today's, my talk will focus on good health and well-being for the northeastern part of India, and how IIT Guwahati is contributing in this direction. And my talk would be resilience and transformation in healthcare, particularly the emerging areas in future. As we know, COVID-19, this coronavirus, which is actually a bigger particle, more than 100 nanometers, is actually affected all of us, entire the whole world for the last 4 months. And even we at Guwahati know that yesterday again we have a lockdown of many of the city areas up to 12th of July. About close to 10 million people are affected across the world. 500,000 people are dead. In India, we are reasonably, I think we have managed it very well, thanks to all the government, all the state government and central government with the great plans. In India also, if you look at it, we have more than 510,000 cases as on today, but we have only 5,689 deaths. Very, very small when compared to what world has felt. More than 183 countries have felt the effect of COVID-19 coronavirus and reported very drastic effects. Most of the countries are locked down and all the industries are closed, all the educational institutions are closed. What is interesting is, luckily, all over the world, as of the month of June, more than 50% have recovered from this COVID-19, when we do not have any vaccine or any direct medicine at all. So this is one of the biggest challenges to humanity post-World War II. And 50% of these people recovered, even in India. And I think there is a good chance that our immunity system is much better than the other part of the world, so we do not have many deaths. So this coronavirus, COVID-19, was preceded. It is not like a surprise. It was preceded by SARS, MERS, Nipah, Ebola. Earlier also we had seen such, but this is really the worst. So we had actually two choices at IIT
sorry
Guwahati. One side, fitness to this Nature's Act, but we chose to act at IIT Guwahati.
Sorry to interrupt you, sir.
Yeah.
Sir, your slide is, could you make it full screen, sir? Half is coming actually, sir.
Yeah, that is what I was also thinking.
Yes,
Okay.
this is,
Thank you.
I think this
Thank you for reminding me. Is it okay now?
this is better than the previous one.
Now?
Okay,
this
this will work. This is better. I think this, now you are doing full screen. I think now you are doing full screen.
Yeah, I did that. Let me see. Slideshow.
Huh. I think Suman can guide.
Yeah, it's a very slow system.
This slide will be okay, sir. Earlier it was how
okay.
it was coming actually.
Yeah. All right. So at IIT Guwahati, we chose to act, and as we know, South Korea actually has managed this pandemic reasonably well. So what they really did is basically early and mass testing, flexible and rapid response they've created, and what it involves many things. Now we are also learning contact tracing, and you might have seen in Guwahati also the administration is doing a fantastic job in tracing the contacts and identifying. So, but this pandemic has really caused the chaos to all of us, and our life is no more the normal. We at the institute, we have actually sent out all of our students back home, and almost more than 6,000 students have gone home. We have a community, very small community of about another 4,000 left in the campus. So, but at the same time, I would like to take a larger problem what India is facing. India has a shortage of almost 600,000, that is 6 million doctors and 2 million nurses. How this shortage has been read is basically the World Health Organization recommends a ratio of 1 doctor for 1,000 people. So that means we have a deficit of almost 600,000 doctors, and the nurse to patient ratio is also recommended as 1.483, that is 1 nurse for about 500 people, implying a shortage of almost 2 million nurses. So right now what we have in India is 1 government doctor for every about 10,200 people. Most of our 65% of our health expenditure is out of pocket. So we do not have really a public health insurance system for the entire country when compared to the developed countries. And such expenditure push almost like 60 million people into poverty every year because they have to spend a lot of money on the healthcare. But however, the story of the pharma industry is completely different in India. The pharma industry in India is a leading producer of cost-effective and quality-controlled generic drugs for the whole world. Actually, India supplies around 20% of the global pharmaceuticals demand in terms of volume. You can see on the right side, you see, when I said the doctors, all doctors, starting from Unani, Ayurveda, and also the allopathic, all doctors, you can see some of you may not be able to read it, but I will share the presentation so you can actually look at these numbers. So India is actually share of generic drugs in India from a pharmaceutical market revenue is almost 70%. Value of Indian pharma exports is huge actually, 19 billion Indian rupees. So considering the number of people, number of doctors per population, and when compared to the medicines what we produce, actually in the medicines part we are doing reasonably well. So let's look at the global healthcare system for a while before I go into what contributions we have made. Global healthcare system is fundamentally changing. Advances in technology, new entrants from outside the industry, and changing consumer expectations are driving a global shift in the healthcare landscape. At the same time, chronic diseases, social determinants, and resource limitation continue to add pressure because, like the one what we are facing, the pandemic. These powerful forces are pushing traditional models of care delivery, and healthcare companies face a choice now to transform to be part of the future or risk being left behind. So we have to look at the completely the outer box ideas and take the healthcare to the nook and corner of the country at a very affordable price. That's the basic gist of my talk. So we have to take this healthcare to nook and corner of the country where there is no accessibility also. So we might have to go with drones, and we might have to use the technology, mobile phones to deliver these kind of healthcare system across India. The transformation of healthcare has to happen. We have to adopt a consumer-centric focus, whether they can afford what we are to do, what we are delivering. That's the major crux of the problem. Shift to preventive and outcomes-based care models, embrace digital and technology enablers, engage non-traditional value chain partners. So we have to involve many people. It has to be collaborative and drive improvements to access, quality, and affordability of healthcare. So the global challenges, if we look at it, overall, everybody would like to have an improved healthcare ecosystem, but at the same time, our population growth is increasing, rate of implementation is also becoming challenging, and there is employment opportunities. So we have to ramp up the existing infrastructure in the healthcare, increase skilled healthcare personnel, boost rural health and public health systems, and that's where we need to tackle the migrant laborers and workers. Empower life sciences research. That means we need to do more and more in life sciences research. And that's where the contribution of IITs, particularly IIT Guwahati, is in a great stride. So I will show you some of the incidences where we have done so much work on the life sciences area at the Institute of Technology, Guwahati. And you will be very proud, particularly coming from the Northeast. So we have taken up a multidisciplinary. Please remember, IIT is a technology institute. You might all think that what is there for healthcare, but we have taken a multidisciplinary translation and research and development, which really changes the way you treat a patient and you treat you deliver the healthcare to large rural mass. We have to inculcate precision manufacturing skills. That's where how our startups and entrepreneurship things have developed. Most of our companies who have started at IIT Guwahati, majority of them are in the healthcare sector. And this education in the healthcare and a multidisciplinary area leads to employment in the Northeast itself. So we have a plan actually at IIT Guwahati to start School of Health Sciences and Technology, which will address the issues associated with the ecosystem. So that's ecosystem I'm going to talk to you today, and promises a better readiness for future challenges of like COVID-19 or any other particular diseases. As we all know that focus of IITG is, or any other institute also in the country, is we have to meet the sustainable development goals for which all the countries are signatories. United Nations adopted this in 2015, and we have up to 2030 to implement and reduce the poverty and make people have a good access to water and food, quality education, gender equality, clean and water and sanitation, and many 17 goals you are seeing. We are only left with 10 more years to fulfill the needs. So we have to implement. With this focus of implementing, and particularly in the area of good health and well-being, IIT Guwahati has started looking at many of these innovations. Before I take you to the innovation, incubation, and translation research, what IIT Guwahati is doing, but I would like to highlight to you that we are already recognized by the standard ranking institutes across the world. See, recently, just about 10 days back, National Institute of Ranking Framework of 2020 have ranked us both in engineering and overall 7th in the country. Okay, That means we are the number 7 institute. You should be very proud that Northeastern, in the entire Northeast India, among all the 7 states, there is only one IIT, but it is competing very well with the mainland. So that's what is important is about. And we have also one of the beautiful campuses, and we have got the Swachhata ranking, and in the QS World ranking also we have moved in the last year, 1 year, from 491 rank to 470. We are now number 470 in the world, and we have a dream of going to 150 in the top 150 universities in the world in the ranking. IIT Guwahati has improved from 71.2 marks in the year 2020 in the global rank with of 89 to 55 global rank, which is really a great thing. And Nature Index has really indexed us very well in chemistry, life sciences, and physical sciences. And IIT Guwahati actually ranks. This is one important thing I would like to highlight to you. Citation per faculty. That means our faculty publications cited by others per faculty is highest in the country. We are number 3 after Indian Institute of Science, Bangalore, where Vibha was born. Where I'm also a professor at Indian Institute of Science, Bangalore. Last 27 years I served there. Now only from last 1 year I am at IIT Guwahati as a director, and IIT Guwahati ranked 3rd after Indian Institute of Science and IIT Roorkee, and we are number 3 if you look at the citation per faculty. So we have published in the leading science journals, and we are the leading science and research institution in India in terms of research citation. Our work is actually a multidisciplinary approach. We work in fundamental research, and we work in industrial research, and we also look at activist policy of Government of India. So that means focusing a lot of activities towards the Northeast. So, and also our faculty and students have contributed to the societal aspect, part of how the healthcare system we are looking at. Okay, so we would like to actually start a School of Health Science and Technology around the programs what we already have. See, please look at, we have the programs on micro, nano electronics, viral and infection diseases, or biosciences, bioengineering are working, cell mechanics, including mechanical engineering, and biosciences, bioengineering scientists. There is a good marriage of science and engineering in IIT Guwahati, and a lot of sciences, and we have a startup on our research parks. There are technology incubation companies in IIT Guwahati. More than 15 companies are presently housed in the TIC, and then more than 10 companies in our research park. They have people on our campus, and then we do have a lot of incubators already graduated and started their own companies elsewhere in the country. We have a paramedical school trying to teach some of this training. I will talk about that in a little while. And we have a lot of industrial R&D and Center for Nanotechnology. So we have this excellence in these areas. We would like to make that through a network of hospitals, doctors, and we would like to make IIT Guwahati as a tower of excellence. So we would like to network with all the people from as a top tower of excellence to the network of excellence, and work for the 7 northeastern sister states, including Assam. So we have tied up with all the NITs and all the CFTI institutes. After I came here, we have signed MOUs with all the institutes so that we can work closely in the different areas of research and development. So the next, why IIT Guwahati is looking for School of Health Sciences particularly. So we have, as I told you, we have a multidisciplinary teams in chemistry, physics, that means sciences, engineering, starting from mechanical to sensors to electronics, computer science, and we have also social scientists. We have one of the largest humanities department in IIT Guwahati. If some of you did not know, we offer even programs like MA. We are not just IIT means not BTech and MTech programs. We do have all different kind of programs catering. So we are a multidisciplinary team sitting here with almost more than 450 faculty and more than 7,000 students. And out of that, almost half of that, students are PhD students, that means our research scholars. So we have a best-in-class curriculum, modern teaching techniques involving international faculty who comes to IIT Guwahati. We have very early introduction to multidisciplinary immersion of R&D activities to our young students and familiarizing students with frugal innovative technologies, including, see, our students go to small villages and towns in the Northeast and look at the techno-medical challenges. And also we have transformed from urban to rural, and we have an innovative assessment system in our system. So we have empowered actually all our faculty to do the assessment independently, and the introduction to alternative systems of medicine in our campus to study under science and engineering, which I'm going to highlight to you in a little while. So with this idea, we thought that we will start School of Health Sciences and Technology, marrying the health sciences to technology, and I will show you how the innovations have brought out a lot of products in this area. So the key factor to do this, we have to look at the infrastructure, emphasis on the hospitals, indigenous translations, and healthcare workforce, rural and public health systems, and industrial research. And at the end, as I said, Atmanirbhar, that means self-reliant India to make. We have to also manufacture these products, what has been incubated, startups and accelerators, and with our entrepreneurs, with a focus to product to market. So we have, as I told you, Niti Aayog to support our startups at IIT Guwahati Research Park. So we are encouraging a lot of our innovators to start their startup companies in our technology incubation hub, then graduate with the industry collaboration to start up their the industry itself in our research park. So we have worked on different areas even during this pandemic. We have actually let a large number of even entire RT-PCR, all the COVID testing, I'm very proud to say, is being done with the IIT Guwahati RT-PCR machine in all the Assam hospitals. See, we have given our 3 RT-PCR machines to Guwahati Medical College Hospital, and 1 to IASST, okay, and 2 to our district administration of Kamrup Metro. So that means almost 7-8 our RT-PCR machines were really evaluating the COVID-19 patients for their COVID vaccine are all from given, we have donated them. We have actually removed from our labs, handed over to the officials so that, we can help the state government. And we are also, our faculty is developing vaccines. Our faculty is developing, was working on drugs and testing of them. And we have, our faculty has manufactured the N95 masks using 3D printing, oxygen concentrators. We have developed ventilators. Our ventilators is going for manufacturing now with an industry partnership. And we have developed large amount of sanitizers and UV disinfectors, which are all actually manufactured, and we have patents on these. And we have also, our faculty has developed PPE kits, PPEs, hygiene, and apart from education, we are actually focusing on all these. And our Nano Center has also looked at e-health models. I'm going to highlight some of those things in a little while. So our goal is to develop a hospital along with all these innovation which happens with a ecosystem of startup entrepreneurs and then hospital, and around that we can also manufacture indigenous medical instruments in the country around this in the Northeast itself. That's our goal. So, and also have a nursing college. So with this idea, we have already started. We have made a lot of, in 1 year, we made a fantastic progress, because we are on our board of IIT Guwahati has approved from our idea of School of Health Sciences and Technology, and I will show you some of those incubation centers, healthcare startups we have already started, where we are focusing on Make in India program, and we have more than 10 centers of excellence in multidisciplinary area, and also a network of e-health clinics are also being run by our health workers jointly with our Nano Center at IIT Guwahati. So this health primary, please remember, primary to health, tertiary healthcare, if you look at the distribution, see, most of the problems in the rural health clinics operated by trained health workers and connected to main hospital, so almost most of your problems will be 60%. You can solve it. Most of the problems of day-to-day healthcare can be handled by simple rural e-health clinics with electronically delivered. So that's what we have to look at the future. And then secondary care, where you require a little more special hospitals and network of medium hospitals, they can deliver 30%. Tertiary care is only 10%. Very high specialty care hospitals. So we do not really need to worry about the tertiary. We need to focus more on primary and secondary care. That is where our focus looking at IIT Guwahati. We wanted to give solutions of innovative solutions, innovative products in this area. So the primary ecosystem, what we would like to create, are partly is there already, which should be financially sustainable. And using the telemedicine healthcare with the quality education, we would like to see the paramedical school, and then from there the graduates will come to our School of Health Sciences and work with our scientists, and then we will have rural entrepreneurs where we could also get back the data from the rural healthcare and work with the frontline workers, and so that we can create push-pull R&D activities almost across the state and way across the state, across the Northeast. So that's the model we would like to work, and this we would like to make it financially sustainable for the country. Because as I told you, the doctors per population is very low in India. So particularly we have almost more than 6 lakh villages. If you want to really, India want to become a 5 trillion economy, we need to empower people in our villages. And particularly after this pandemic, most of the migrant workers have gone back to their villages. Please look at that. So we need to give good quality water, food security, healthcare, education in our rural areas. So we need to make our villages smarter. So then only we become a 5 trillion economy. If to want to become the Indian smart villages, to really to become we need entrepreneurs, and we need to employ all these 6 lakh villages. So we have to educate them, we have to provide healthcare to them. So to do this, I think we have to have a bigger vision and looking at healthcare. Healthcare is going to drive our economy. So that's what I'm going to focus on. And we need to prepare this. In IIT, we have, as I told you already, our faculty, staff, and students and entrepreneurs, and working with doctors in around Guwahati very closely. And you might have seen in the news media that even the kit for VPM kits or RT-PCR kits are completely manufactured within IIT Guwahati, and we are now delivering it to the Assam government for testing for the COVID-19. So not only just the RT-PCR machines, even the kits are manufactured jointly with industry in IIT Guwahati. And we have the departments, centers, and Center for Excellence in both engineering and science. We need to establish the medical school, but we have medical electronics and instrumentation and sensor. We have startup and incubation culture. We have schools for skills. Particularly, we have one NSDC school operational for the paramedics and healthcare and technology. And we are working closely with e-health clinic project approved by ICMR. And we are also interacting with a lot of village things. I will show you some of the products which have been developed by our nano science. Nano center, nano fabrication center is one of the best in the country. Actually, I will tell you, I come from a University of Science. Our IIT Guwahati nano fab facility, which is going to be ready in another 1 month. Right now, it is working from a smaller lab, but the full blown will be ready. And when it becomes, it will be #1 in the country. Public health, we have working on a lot of public health software and programs, and we have done a lot of work, as I told you, in COVID-19, which gives us confidence. So whether it is testing facility, masks, sanitizer, ventilators, oxygen concentrator, or diagnostic tools, or training materials, all are developed by our scientists at IIT Guwahati. This is the team. I would like to not show all the 450 faculty, but we have a focused team. Okay, both from chemistry, nano, and electronics, computer science, chemical engineering, civil, even bioscience, bioengineering, and we also have doctors from JNRC. who are working together with our team, and then AIMS, you can see, and also Shankardev Nethralaya, GNRC Hospital, and we have a very fantastic collaborative team with physicians and entrepreneurs also. Dr. Satarwal Saha is one of our collaborator who works, and also from our own alumni who are working in our biotech park as well as in the institute are part of this team as well. So I will just take you through some of the products developed by IIT Guwahati in the area of nanoelectronics and theranostic devices. So which we received a funding of almost 60 crores from Ministry of Electronics in 2014, and up to 2021 we have been completely funded by the Nanoelectronics Center. And you could see some of those, our center, new center is going to come with 6,000 square meters. It's almost complete. Maybe in another 2-3 months, this entire facility, the second picture, what you have in the middle, the building will be ready. We will shift our nano center to there. So that will be a huge facility for the entire Northeast. We have a fabrication facility there, almost with ISO 5 and 6 clean rooms, litho, electrospinning, PVD, CVD, and all facilities for characterization and testing. And kindly mute. I will only take another 5 minutes. We have filed, our team has filed more than 11 international patents and 30 national patents. We have published large number of patents already, and a large number of PhDs are produced in this lab, and there are many startups are coming up in this. So these are some of the emerging products. See, they are all miniatured now. Okay, they're all miniature. You can do the blood testing to urine testing to all kinds of testing, automated and digitally transferable and accessible through your mobile phones. So that's the kind of technology we are looking at. POCT devices for rural health. Then automatically, a test would have costed you 300 or 400 rupees. Now will cost you 3 rupees to 5 rupees. Then automatically it is portable, easy to use, real-time results, affordable tests with low-cost devices. All of these are verified. Please understand. These are verified. They're robust for any environment, and more than 25 tests are integrated in any of these single blood or urine testing. IoT enabled. So we are many concepts of being fabricated, whether it is bilirubin or albumin, creatinine, all kinds of testing and sensors are fabricated in-house in our campus. And a beautiful magic box is also done jointly with a very collaborative effort. Okay, the cost of device you can clearly see now. The magic box, see the cost of Indian rupees is 5,000 rupees when you look at the clinical devices of the similar nature to test them, which will huge cost. So, and also the beauty of this is the magic box is you don't require a skilled manpower. You will get an instant result. You don't require a large infrastructure. You will have a sample size is very small, and it is handled, and it is robust, and it is a fabrication, and it is IoT enabled. So this is the beauty of these technologies, what our faculty are developing. We also, as I told you, we also have a one skill training center at IITG, what is for healthcare and technology, and we have done a lot of courses already for the training the rural healthcare workers how to use these tools, so that they would be our delivery. So that's where you can create large number of jobs. That's where I'm talking about engaging with all the 6 lakh villages in the country. E-health clinics are also, we are looking at technology with electronic health records. You should be able to look at the community with a community health worker, the training what we are giving, and the beneficiaries is large mass of people in the villages. And so that means we can deliver this technology through online. Okay, so this is the telemedicine. So we can actually do all through the telephone and internet. So the major objective of doing this kind of a School of Health Sciences and Technology is healthcare delivery to the last mile population. And we want to bring in the medical and allied education system along with technology. and research. Integration of physical sciences and technology with life sciences is the focus of our objective. And now you can see the entire ecosystem now. You see, we will have smart villages and we will have a product development. This is only for the Northeast. Please look at our vision. See, this e-health clinics and rural entrepreneurs we are going to train, and we will be working directly with the smart villages. But IIT Guwahati will develop the R&D and startup and skilled entrepreneurships with a server and health data collection, so we can analyze the data and send the technology or the kind of corresponding healthcare solutions to where it is needed. So, and we also have international collaborators where we can exchange and we can learn from them and bring the total healthcare solutions from urban areas to rural India, to hospitals, center for excellences, industry, and startup. So this is a complete picture of ecosystem where you can look at the industry startups and productization, commercialization, and sustainability of the products also been looked at. And we are also looking at rapid ethical clearance, and we do have ethical committees in the campus. We are not doing randomly, so we go through very regular procedures, and we have clinical validation working with the national labs and field trials and certification. So we would like to inculcate this multidisciplinary research for translational applications across Northeast. So the component one is the allied education. As I told you earlier, we require more than 600,000 doctors, that is 2 million nurses, and 50,000 the health workers, and health building and disease management and many other quality improvement and cost reduction techniques are required. And this can be achieved only through multidisciplinary R&D and data science in healthcare, because we need to understand the data where we need to deliver. And the healthcare management is the key aspect of it. So we do have Center of Excellences in IIT Guwahati in virology and infectious diseases, nano biosciences and technology, traditional medicine and practices using Ayurveda, biosensors and biomaterials, cell biology, newer assays, frugal POCT diagnostic devices using our nano center. We have large number of software and algorithms to analyze the data. We have also simulation training centers. So this kind of comprehensive collaborative solutions with a focus on multidisciplinary R&D is what is going to take us to the next level, next generation delivery. So summary of deliverables, we would like to look at it like establishment of Center for Excellences, nursing school, medical college, and it will take some time, but however, I'm very confident that these can be. So we have also looked at it, how much it costs and how it will be done. So maybe by the end of 7 years, it will be a sustainable model which we are going to develop. So healthcare of the future, as I told you, India has 600 million smartphone users in 2020. It is likely to be 900 million by 2022. In 2 years, we're going to have almost 1/3 jump in the smartphone users. That means smartphone are going to be the delivery for us. With lower than ever data tolls using like a Geo, increasing smartphone penetration in the country is definitely in the scene. Internet consumption is clearly on the rise in India. Leapfrogging technologies, a mobile-based, tech-based healthcare system with nano and miniature sensors are going to be the future. As I demonstrated to you, our faculty have developed such small healthcare which is cost-effective, it can be taken by hand to all rural areas, and also not much of a training is required to use them. So as lifestyle changes, our chronic diseases are also increasing. So we have to cope to this at a scale, unimaginable scale. You have to jump the scale. So that's the kind of things, because we are 1.3 billion people, ladies and gentlemen. So mobile health-based system, and with more than 450 startups have already emerged in India. You might think that it is not a new idea. It is already there and offering digital health solution for almost 500 million people who cannot afford healthcare in India. This is what the goal, and IIT Guwahati is trying in this direction. And with these few developments, I would like to welcome you to see what contributions were made during COVID-19 for the entire Northeast. So we have developed actually, I didn't actually talk about all that, the Yantra bot to deliver food and medicine to the COVID patients remotely with a robotic. Our people have developed, and we have automatic scanning systems for scanning temperature and also symptoms, which we have installed in the campus. So we are taking them, and our the virus. There are many scientists are trying to work on the local, based on Ayurveda, the medicine, and other things are also they're trying out integrative healthcare solutions for this problem. This pandemic has actually given us a lot of opportunity to do and innovate. That's what has happened, even though we don't have students on our campus right away, but still about 100 students are still there, and along with our faculty have worked day and night very hard to develop all these new products, and closely working with industry, we are able to produce almost more than 45 products in this pandemic period. So this is what I would like to share with all of you. And this is our vision of IIT Guwahati in the transformative healthcare for the future of India. So thank you very much. So this is all. If you have any specific questions, I will take it. Thank you very much. Hello.
Thank you, sir, for your for the presentation. You have covered everything about IIT Guwahati. We expect that as IIT Guwahati is doing a tremendous job, so I believe this is the responsibility of IIT Guwahati also to take up all the institutes, all the colleges which is available here in the northeastern part, so that we all could grow together to fight against this pandemic situation. Thank you, sir. One question that I have like to ask from the hello, sir.
Yeah.
Hello, sir. Yeah, this is a general question. Yeah, this is a general question. Yes, a general question received from Gargi Yadav. Question is, why is healthcare is not provided free to the citizens in India like Australia and many other countries? How it can be done in India?
So, sir, I told you, we are a poor country. Our healthcare, also, as I told you, number of doctors are also very, very small. Please understand, we do not have large number of doctors. And we have more than 6 lakh villages, which are remote. Some of them are not accessible. There are no roads itself. Particularly if you go to Arunachal, Nagaland, it's very difficult to reach out some of the villages. So how can you expect? And our cost, the healthcare cost is so high. That is why I think we need to innovate and do something uniquely, and which costs you very small. The technology has to be delivered through. That is why I said that this electronics and communication technology has given an opportunity to serve every citizen of India. That is what we are actually aiming at, to take these products, take this technology to, then we will be able to deliver healthcare system to all in India. So if you are going with a conventional method, it will be so expensive. There is no way you can deliver this to the entire 1.3 billion people of India.
Yes, sir. Yes, sir. Thank you, sir. So, thank you. We expect your presence for the other presentations also. And thank you, sir. So, I think this is a very great presentation from Sitaram, sir. And I myself and all the participants will be benefited. We are knowing everything about IIT Guwahati, and lots of kits and VTM kits. Everything is coming up from the research team of IIT Guwahati. Good scene from IIT Guwahati. So, as we have already understand that we have to move towards traditional system. So, our next speaker is Dr. G. Geeta Krishnan ji. He is Technical Officer at the Traditional Complementary and Integrative Medicine Unit of the World Health Organization at Geneva. So here again, I'd like to request all the participants to switch off the video and mic so that it will be audible to all. Again, Dr. Geeta Krishnan ji, he is Dr. Geeta Krishnan ji. Sir, are you available, sir?
Yeah, I'm here.
Okay, sir. Dr. Gita Krishnan ji is Technical Officer at the Traditional Complementary and Integrative Medicine Unit of World Health Organization, Geneva. His current work with WHO entails global standards of practice and training in traditional medicine development standards. And analytical systems for morbidities managed by TM. He is also responsible in development of digital tools to support safe and effective self-healthcare practices in the area of health promotion and is engaged in supporting low and middle income countries to develop national policies and guidelines for the appropriate use of traditional medicine within the national health systems. He is researcher and clinician. His broad background expertise is in Ayurveda with specific skills, training, and experience in integrative medicine, herbal drug development, policy, and advocacy. As a clinician, he has 2 decades of experience, of which 9 years was spent working in a large integrative medicine facility in India. With these words, I'd like to request Dr. Gita Krishnan ji to deliver the speech on traditional drugs to combat infectious disease and their authenticity. Over to you, sir.
Dr. Bula Chaudhary, thank you for giving me this nice introduction, and I would like to thank Jain Ji Sahasrabudhe ji, who is here and who has inaugurated this session, and for all the support that Vijnana Bharati is offering in this particular activity. I would also like to thank Dr. Sita Raman, Director IIT Guwahati, for the wonderful presentation he had made before this, and I would specifically like to thank Dr. Rajiv Chandra Sharma ji for inviting me for this meeting. So with this, I have a very small talk to make. I don't have any presentations. I would like to speak on my experiences, based on my experiences as a clinician, as a researcher, and as a policy, developer in World Health Organization in the past and activity in health sector. I would like to take you to a few of the experiences that I had. For example, in 2015-16, there was a large epidemic of dengue fever which happened in India. Especially, it was very severe in New Delhi and Gurgaon area, where I was practicing. And we were getting, several patients in a day, even though it was a private hospital I was working in. We were getting several patients in a day. So dengue, as you know, has a serious side effect. Many patients in dengue, almost 1% of the patients in dengue die, and many of them enter the intensive care unit, and the critical care unit can be really bad. It can have the same thing which happens in the COVID case, like a cytokine storm, and sweating of the intracellular fluid increases, and then it becomes complicated. Your kidney is lost, your liver is damaged, your heart also gets damaged, and all those things. These things happen. So since this hospital I had been working with this hospital, which is an integrated facility of 1,500 beds. I was closely working with several systems of medicine, several departments in the hospital, specialities in the hospital. And the internal medicine doctor, who is a quite good friend, asked me, she was the head of treating management of dengue. She asked me, do you have something to do for dengue care? I said, we could try something. And we analyzed dengue fever. And we identified it as a kind of, the pattern of dengue fever could be identified as pitta, Pittadiga, Sannipadiga Jara. That's one of the classifications in Ayurveda. And we identified drugs for that particular situation and gave it to the patients. So there were some benefits, and we thought that we had some benefits. So we decided to do a clinical trial on this. And we looked at 94 patients who got admitted in the hospital, not just because of that, but they had mild symptoms which have taken them into critical condition and who needed admissions. And we started medicine with patients. In that, not a single patient, 90 patients here. It's a number. Uh, yeah. Can you hear me? Okay, so this out of this 94 patients, not a single patient went into like critical care, and everyone, nobody expired. So it was a wonderful experience that we had, and then we presented this data to Indian Council for Medical Research, and I at that time Dr. Soumya Swaminathan was the head of ICMR, and she took it up very seriously, and then the study was taken up by the Belgavi Institute of ICMR and as an independent study to verify what we have done, and they found exactly what we were doing. That what we did was right, and now I think this particular drug is coming out from ICMR and Council for Ayurveda Research, Central Council for Ayurveda Research, as a drug for management of like dengue fever. So that's something which we are expecting very soon. Another study which I would like to bring to a notice is like even though diarrhea is a very is thought to be a very simple disease, it is one of the largest largest reasons for mortality in India. A lot of children die due to diarrhea, and diarrhea usually does not occur in urban places, or not even in places where there is very good infrastructure. Usually diarrhea and diarrheal deaths occur in remote villages and places where you cannot reach. There is no information, there is no knowledge system available there to manage such conditions. And there is no infrastructure to take these people to the correct doctor or to the hospital. So in such cases, we thought that a locally available medicine or a medicinal plant, if it could be used as a drug, could be very effective. And we started scanning for such drugs, and we found that the leaves of guava, अमरूद जो फल है जो हम खाते हैं, उसका leaves, we found that it has been used in many parts of the country, especially in northeastern part of India, as an anti-diarrheal drug. And we selected this drug, but the information that was not available was what is the quantity that was used, etc., etc. So that kind of an information was not available, and this was also anecdotal evidence. There was no real evidence out of it. So we actually tried this medicine in different dosage forms in people having infective diarrhea and who might benefit from antibiotics, but then we didn't give them antibiotics, and we started giving them these leaves of guava in different quantities.
All the non-intensive treatment surgeries across the country. Sir, please continue, sir. Please continue, sir.
Okay.
Please continue,
So,
sir.
yeah. So we found that when we used 14 leaves of guava and a decoction was made out of it, and it was made into 30 ml, very small quantity, like not even 30 ml, 20 ml thrice a day, made people better than when the control group we had antibiotics being given. We could get better results from guava leaves than even from antibiotics specifically given for management of diarrhea. So this has been a published paper, and we had published this paper recently, and Journal of Ayurveda Integrative Medicine has published this paper. This has been done with the Foundation for Medical Research in Mumbai, and collaboration with the hospital which I was working with in New Delhi. So then another area which I found integrative medicine quite useful was in post-surgical situations. Like when you do surgery, especially very serious conditions of surgery. For example, a thoracic surgery, you open the chest and then you sew it back after doing the work within the thoracic cage. For example, probably you had a valvular replacement, or you had a some disease, some management of your lung disease, or it could also be some another issue with the heart, etc., etc. There could be many things which can happen in the thoracic cage. So once you surgically suture it back, then because this is a major surgery, patients are not fed food for the almost 36 hours before they go into surgery, and almost for about 36 to 48 hours after they have surgery. So they have usually some nutrient liquid taken in small quantity after their surgery, but not even enough to enough to fill their stomach, or not even to quench their thirst. So these people usually, because they are not having food for almost 4 days and taking all the antibiotics and all, they develop many of them develop constipation, and this is a very common situation in cardiothoracic surgery. What happens is these patients, many of them develop constipation because they don't want to like to try to pass motion also, because they think if they exert, the large number of stitches which had been put on their chest might get burst, and they don't do it. So in such cases, we had because our hospital was also a specialty on cardiothoracic diseases, we had a large number of patients in such condition, and the benefits of modern medicine given to these patients was not so effective. So usually our cardiothoracic surgery head was very keen on Ayurveda and asked us whether we could do something for it. And we found that 2 ml of an Ayurvedic medicine given with a little bit of sugar was much more effective than several doses of medicines which was given from the allopathic side to loosen the stools of these patients, and patients were much more compliant with the Ayurvedic medicine. So when I was leaving the hospital, every single constipation patient post surgery in cardiothoracic surgery unit was getting Ayurvedic medicine in an allopathic hospital in an integrative fashion. This is quite a lot of work which we are doing there. I also had the fortune to work with stroke patients, and immediately post stroke management by the stroke specialist. So they would have done their surgery, or they would have done their intervention, and immediately, along with the modern physiotherapy, on the same day as physiotherapy starts, Ayurvedic intervention starts. And we have been able to show that when Ayurveda and modern medicine works integratively, the results are much better than only allopathic interventions happening with stroke patients. And we had presented that in the International Stroke Conference, which happened in Hyderabad in 2016 or 17. I think it is 2016. Now, we also had been able to work with radiation therapy patients. Most of you are technocrats, so probably you will understand that when radiation therapy is given to a cancer patient, the dosage of radiation is dependent on the size of the tumor, as well as on the weight of the person who is having the tumor. This is one of the main criteria for deciding the dosage of a radiation therapy, a radiation dose. And when you have cancer of the upper neck and head and all, and when you give radiation in the upper part of in the neck and head region, then most of the patients develop stomatitis. Stomatitis is the inflammation of the inner lining of the stomach. Of the stoma, which is the mouth. And what happens is people have very painful stomach. Very painful mouth and ulcers. They lose their weight. I told you earlier that the dosage of radiation is dependent on the patient's weight and the weight of the tumor. So if the patient loses his weight or her weight, then the same dosage of radiation cannot be given to the patient, and there will be suboptimal results which is seen in the patient. And this is a very difficult condition in radiation therapy, and it's something which many patients have to suffer a lot because of this. So what we have done is we have started giving Ayurveda-based herbal mouth gargles for these patients, and prevent the mouth ulcers and the inflammation of the mucosa of the mouth cavity, of the oral cavity, and therefore patients did not have any kind of problem in having their food in the regular format. And this was a tremendous relief and a benefit for the patient. I had been talking to you about different integrative programs which we were talking about, which was possible in a clinical setting. Now, let me tell you about the integrative programs which are happening in the country in the past several years. The Government of India had started integration as a form of co-locating different systems of medicines together. It has been available for some years, almost 26 to 27 years. Government of India had been co-locating these systems together. So in these systems, what had happened is they have sat together. They used a lot of common resources, but there was no communication between one system of medicine and the other. So they were sitting together, but there was no integrated work happening in between, other than sitting together and using a common facility and reducing the cost for the government. And that was what was happening. Now, you should understand, co-location is not integration. Integration is when two systems of medicine work together for the benefit of a single patient, or two systems of medicine sit together and create a protocol for the management of one particular group of disease. That is what is called as integration. So such integration is definitely possible in the current scenario. Let me take you to infectious diseases. Like for example, COVID. In COVID management, we at present know that there is not enough data available anywhere in the world to say that one particular group of medicine is 100% useful against COVID, or in any way useful against COVID. We have only some ideas, some repurposed medicines which will reduce the symptoms, etc., etc. And that is the current situation. Now, inclusion of Ayush in the right format and integrating it into the treatment procedure can give you a lot of benefit. We have identified, working closely with the modern medical counterparts who are taking care of COVID, and looking at the COVID patients closely, we have identified that the pattern of Ayurvedic, the pattern of COVID in its different stages is very common or very similar to the pattern of Vata Kapha Sannipatika Jwara, which is mentioned in Ayurveda. So it is we have very specific treatment for Vata Kapha Sannipatika Jwara as far as Ayurveda is concerned. And we as a group has started this as a clinical trial by 22nd of April in one of the large hospitals in the country. And this same medicine has been taken up as a national protocol of clinical trial by Government of India, and it is being done as a national protocol across the country. Now, the results are in process. It will take time. There is nothing to talk about it, but what I can say is that those doctors who are involved in the study, especially in the place where we had already started the study, have, after seeing the results of the patients, every single doctor and a clinician in that hospital who is working closely with the COVID patient will not go into the COVID ward without taking the medicines from Ayurveda. So that is the situation. I don't want, this is still probably because of their belief, they think that patients are benefiting. These are all possibility of lot of biases there. So we don't want to make any claims, but I think we have excellent medicines available in Ayurveda for COVID management. And we think that in the next probably 1.5 months, we will be able to publish this data with lot of what is called data, a lot of scientific evidence and all the studies, all the required data collected and collated and analyzed in the most appropriate manner. So this is something which I would like to inform you, and I would also like to tell you that in terms of other diseases which in future might evolve, Ayurveda is one place, or traditional medicine is one place where you have to look at for looking at, for example, antimicrobial resistance. It is going to kill 10 million people every year from the year 2030. That's what World Health Organization says. So if you can manage that, if you can reduce antimicrobial resistance using traditional medicine, there's a huge scope in it. No new antibiotics are coming out. All antibiotics have expired their capabilities. We are facing a major trouble in management of microbes. We thought about 5 years before, or maybe 10 years before, we thought that we have overcome the problem of microbial diseases, and now NCDs, non-communicable diseases, are the major threat. Now we have realized again that not the microbial diseases or communicable diseases just went behind the curtain for a short rest, and it is back with full form. And we have a lot of work to do. We as a community, as Dr. Sitaraman very specifically said, we as a community are a very resource scarce community. We have a lot of people, we have a lot of work to do, we have a lot of infrastructure to build. It all takes time. We cannot only rely on what is coming from outside India, what is coming from one particular system of understanding of health, or we cannot only rely on the chemical based medicines anymore. We have to look at natural sources and natural resources, and traditional medicine is a repository of that, and we should look into it. And I hope that there will be more and more collaborations between organizations like IIT, Guwahati, and NIPER, and excellent medicines will come out of this country, which will be looked upon and valued by the entire globe. Thank you so much again for listening to me. And I can take probably one question, and I would like to thank Rajiv ji for giving me this opportunity.
Thank you, sir. Thank you for the nice presentation. There are lots of questions are coming. One question that I like to say, you have said lots of about the integrative medicines and what actually your part is doing. So, is there any database where attendees or anybody can say what is happening, and is there any database on this regard?
You mean database on the current activities that are happening?
Yes.
Or you are talking about it?
Yes. Integrative.
Yes. No, I didn't understand. There were two questions. One is, are you asking about database on the current activities regarding COVID, or are you asking about database on the integrative medicine?
Everything. One question that come, we can access this integrative program data that is available online, so that we can study them, come up with some more such integrative medicines.
There is not one single organization who is organizing integrative medicine programs across the globe. So therefore, there is not one single database where you can go and access it. You will have to search for it. You will have to, most of the keywords are integrative medicine, traditional medicine and modern medicine, or you can say, you want to have a particular kind of a disease, you say herbal medicine and cardiac diseases, herbal medicine and so diseases. So, that is how you will have to search. It's actually based on, but there are few integrative medicine databases which is not complete. But you can look at the Journal of Ayurveda Integrative Medicine, which is also very, very well supported by Vijnana Bharati. So you can actually have a look at that. It's a very high, one of the best, most highly respected journal in the integrative medicine area. And you can see that, or probably if not the most respected journal in the integrative medicine field, you can see that. And there are also other universities, integrative medicine universities outside India. You can look for that, especially in US and Europe. You have integrative medicine universities. You can look for that. So, like, it's all based on searching that you will get this data. Not at this particular moment, there is not one single database which will give you all this information. But if you want to know what is happening on COVID-related activity, you should go to WHO website, and you can just type World Health Organization, and it will take you to the directly to the home page, which will give you a direct link to COVID resources, and there you can go and get almost all data related to COVID, which is happening in one single downloadable format. And for getting to know what is being done in Ayush Ministry, you have to go to the Ayush Ministry's website. There is a very beautiful like dashboard they have, and all the work they are doing is seen on the dashboard. So this is what I can tell you about this.
One more question. Do you have time, sir? There are
Yeah,
lots
one
of
more, yes.
questions are coming. Lots of questions are coming. One question from Dr. Sheila Dattaghatak. Direct question. Is there any Ayurvedic medicine for COVID-19?
We don't have any Ayurvedic medicine at present for COVID-19. We have the clinical trials we are doing. We have registered them with the government of India and taken the approval for checking few medicines or for COVID-19. So unless and until the results are out, we cannot say that we have any medicine for COVID-19. But we have medicines for symptom complexes which are very similar to COVID-19. So I am not saying that it is COVID-19, but symptom complexes which give the picture of COVID-19. If it is analyzed through Ayurveda, Siddha, etc., you have medicines for such symptom complexes. And and we are using the same medicines which are useful in the same symptom. Trials, these are effective, or we have to look for.
As you are in the trial, that's why I'm asking.
One of the studies we are already done with all the patients and all the. I think one more patient is getting like we are giving medicines for one patient. We have completed all the 60 patients to be completed. So the results should be out in about 3-4 days, and then we will analyze it, and then we will send it for publication. Then the government will scrutinize it, and if it is effective, then the government will say it is effective or it is not effective. That's how it is.
Okay. There are some other questions.
About a month's time, 4 weeks time.
What is the herbal medicine given for constipation after cardiothoracic surgery?
Oh, we give several of them, but one of the most common drugs we give is Misraka Sneham. MISRAKA. Misraka Sneham. SNEHAM. So you have to be careful when you give this medicine, because higher doses of this medicine will cause vomiting. So you have to take just 10 drops, 5 to 10 drops of it, add it with half a teaspoon of sugar, just take it. Once a day, not more than that. Once a day, and only one dose. Okay. So even if somebody is using it as a trial, you want to try it anywhere in any integrative medicine setting, be very careful. Take a good Ayurvedic doctor as your co-investigator and give very little medicine. It causes vomiting, and vomiting is not good for patients with post cardiothoracic surgery.
Same question, second question from Debasis Datta. Also, name of the herbal medicine used for dengue.
So it contains medicines which include Tinospora cordifolia, Andrographis paniculata, and it also contained Zingiber officinalis. And no, it did not contain Zingiber officinalis. It's Tinospora cordifolia, Andrographis paniculata, and it is Cyperus rotundus and Cyclia peltata. So these are the 4 medicines which it has.
This is a combination or a single six?
Oh, this is a combination.
Okay. So one more question. Can Ayurvedic alternative substitute antibiotics?
Oh, yeah. If Ayurvedic alternatives were perfect for antibiotics, then probably antibiotics would never have been discovered. So, it is a combination of it. And now, if you ask me if antibiotics are enough to manage all infectious diseases, then I would say we would not be in such a crisis right now. So it is
Yes, sir.
right, you cannot say that one side is the best. You have to see that this is like a wave, like sometimes something goes up, the other time the other things goes up. Your job as a researcher and as a policy maker or as a clinician is to bring these together properly and in the most appropriate form. If you do that, then you are successful. Otherwise, you cannot be successful.
Yes, sir. Yes, sir.
Okay.
Thank you, sir. Thank you for your nice presentation. As we all know that we all are moving towards Ayurveda, Siddha, and we all are trying at our home also. So thank you, sir. Thank you for your presentation. I also like to. We also have some questions to IT Director, Sir Sitaram, sir. Sir, are you available, sir? Dr. T.G. Sitaram, sir. Are you available, sir? Dr. Sitaram, sir, are you available, sir? I think sir is not available. So, though we had 2-3 questions for IT Director, Sir Sitaram, sir, we could not take it today. However, we'll pass the questions to him. Definitely, if when the answers will come, definitely we can pass. Somebody is asking about the feedback forms. It will come to you. So tomorrow we are having the sessions by 5 p.m. First session is from Dr. Yuvasan Murthy, sir, Director, National Institute of Pharmaceutical Education and Research. And the second talk we'll be having from Dr. N.C. Talukdar, sir. He is the former Director of Institute of Advanced Studies in Science and Technology. So both the talks will be very helpful. We expect your kind presence by 5 in this platform. Thank you. Thank you for your kind presence today. Thank you.